Hello and welcome to Media7. The release of the New Zealand Drug Harm Index last week provided the police with some welcome respite from a spell, as we noted recently on this program, of some pretty tough press. The New Zealand Herald gave it the front page lead with $1.3 billion drugs bill we're all paying. But no one asked why the index was pitched as news nearly 2 months after it was actually launched by Minister Jim Anderton, or about questions raised by the government's own Interagency Drugs Committee, or about what the index cost, or what value it will actually provide to taxpayers. But it wouldn't be the first time media standards have been suspended when it comes to illicit drugs.
An ex-policeman turned drug educator has been telling politicians that current strategies for stamping out the drug P are failing.
Imagine if a private consultant came from nowhere touting proven solutions to intractable social and economic problems and got saturation media coverage. Wouldn't happen? Meet Mike Sabin. Since he fired off some poorly spelled press releases about his submission to a select committee, he's been media flavour of the month.
We're losing the war on methamphetamine, so it's got away on us.
Sabin says all it'd take to nail the illicit drug problem is zero tolerance, universal drug testing in schools, and, courtesy Sabin's company, lots of this.
Don't do it. Don't do it.
But local drug treatment professionals pointed to evidence suggesting the so-called Montana meth strategy was inappropriate and even counterproductive. They didn't get so much press. Late last year, the Waikato Times claimed that in a disturbing new trend, pea dealers were targeting children with pea-laced milkshakes. The shock headline was based on a statement by Hawaiian drug expert Gary Shimabukuro at a seminar for local police. But Shimabukuro only said that some users mixed methamphetamine into drinks. The idea of pea-laced milkshakes may have been based on the story that American dealers were roping in kids with, quote, strawberry-flavoured methamphetamine. The US Drug Enforcement Agency issued warnings, and there were TV reports like this.
Methamphetamine, cooked, then later coloured in flavoured strawberry to seem like candy.
So that when they consume it, they don't get that bad taste from the meth.
2 US senators pushed through a law increasing sentences for this evil practice. Only problem, as the New Zealand Drug Foundation had to announce twice here last year, the whole thing is an urban myth. Ditto for 2020's notorious Playground Pushers story, which alleged that small deals of marijuana were being sprayed with a fine mist of pee by dealers hoping to hook in new, younger customers.
So if you're smoking marijuana, say right now, you may invariably
be smoking pee at the same time.
The host suggested that pot smokers might unwittingly be smoking pee, but there has never been any evidence this really happens. No arrests, no seizures. Apart from anything else, secretly adulterating a drug that costs $10 a gram with one that costs $1,000 a gram doesn't make a lot of sense. Most experts think it's extremely unlikely, and not for the first time, the tip came from a policeman. Joining us on this week's show to discuss the way the news media handle illicit drug issues are Ross Bell, Executive Director of the New Zealand Drug Foundation, Police Association spokesman Greg O'Connor, and just departed Green MP Nandor Tanchos.
Hello, Russell.
Ross, if we could start with you. We did actually ask for a response from the New Zealand Herald. They said they were happy with what they ran and weren't willing to answer any further questions. You actually did an interview about the Drug Harm Index with the New Zealand Herald, and they didn't use any of it.
They were doing a follow-up story after running it as a front-page story, and I raised some questions. I had a few criticisms about the story that they had run the previous day. I thought I asked some quite legitimate questions about the value of the index and how it would be used. They didn't run those quotes. I also pointed out that the front-page story they had run the day before had some errors in it, including a bold claim around the harms from LSD. They ran half of a point that was made in the study.
They ran half a sentence.
Ran half a sentence which said that a kilogram of LSD causes $1 billion of harm in New Zealand. They didn't complete the sentence which said because LSD is not used that much, it creates very little harm in New Zealand. They didn't run a correction. And the story that they did, the follow-up story on day 2, was around another report that the Herald had got their hands on, again from the police. It was excerpts of a report which hadn't been published, and it was around hospitalisations due to cannabis. And it showed in this new report that 22,000 people were hospitalised because of cannabis. They didn't put that in context. The Herald didn't refer to their report the day before, which showed that cannabis harm, costs of cannabis are very low.
The short version is that you said all these things and none of it was printed. I mean, does this happen to you often, that you actually can't get a quote in the paper?
Look, we are well treated, largely by the media, and they do come to us and they usually report us very accurately. I don't have too many beefs with how we get reported. It would be nice to be quoted when we do say some things, and we were fairly critical of the drug harm index, and I thought there might have been a story in that. We see there's a value in these kind of indices, but it really comes down to how you're going to use it, and the Herald really didn't run any analysis about what the purpose of the...
The fact is that no one did. Everyone just went with the big scary numbers. I mean, Greg, what's your understanding of the utility of the drug harm index? The police have commissioned this, it's their baby. What's it for?
Well, the first thing is the reason why it was in the paper last week is because the Police 10-1 actually published it, which is the internal magazine for police, but it actually goes out to the public. So that's why it was in the media last week and not when Jim Anderton talked about it. It was commissioned by Burl. I think the rationale behind it, I understand, was that normally everyone wants a statistic, and it's normally been about street cost and how much drugs cost on the street, LSD, P, and so people, and I think it came out of the UK, well, it did come out of the UK, was that people were looking for another way to measure it. And the drug harm index was, this is what Burl did, try and put a figure
so
on...
it gives the police another kind of number to be able to put on drug seizures,
basically yes, rather than just saying $100 million worth or $100 worth or whatever. It's another... and like all these things, it's usually the longitudinal value of them. It's not what it says today. It's really comparing it, whether you accept the criteria or not. It's as long as you use the same criteria next year and the year after. That's the important thing of any of these indices.
Well, what about you, Nandor? I mean, this was an analysis done by an economics firm rather than specialists in the field. Were they the right people to do it, Bill?
Well, I don't think so, because, and to be fair, I haven't had a chance to read the entire report, but if you look at it, what it seems to be about is creating a rationale to spend more money on prohibition, because drugs cost all this much money. That includes the cost of actually policing them and the court costs and all those things. So therefore we should be spending more money because it costs so much money, and the more we spend, the more it costs. So it's a perfect circle for the police.
There's a built-in feedback loop in it, because under crime costs it includes the cost of policing the laws.
Exactly.
So the more you spend policing the laws,
exactly,
which Mike Sabin thinks we should, the drug harm index will go up by that much.
And the thing is that a drug harm index, if it was properly done, I think could be really valuable. One, it would allow us to really accurately assess the harm from different kinds of drugs. And secondly, if you disentangle the figures, you could see the cost of the policy, and you could see which are the policies that also create the most harm and are the most cost effective. So that's what we're unwilling to do.
There is actually an index just like that in Australia, and perhaps we can discuss that after the break.